So what do you want to do if your patient's particularly taking a probiotic supplement is how should they take it? They should take it on an empty stomach. If you are going to prescribe it, like the person's not taking any probiotic and you're prescribing an antibiotic, what you want that person to do is take the probiotic 1 to 2 hours after the oral antibiotic or the oral antifungal. And the idea behind that is you don't want the probiotic and the antibiotic in the stomach at the same time. I'm going to tell you right off the bat, there is not abundance evidence that having the antibiotic and the probiotic in the stomach at the same time is all that problematic. There isn't. But common sense says don't have an anti and a pro in the stomach at the same time. And then this is also what's key. You've put the patient on, like, let's say, a week's worth of antibiotic for the treatment of a pneumonia. What you want to do is you want to treat with the probiotic for the week that the person's on the antibiotic, and then for a minimum of 1 to 2 weeks after completing the antibiotic. And what's the mindset behind that? What you will have done with advising on the probiotic at the same time as the antibiotic is you probably minimized the reduction in normal gut flora. But there will nonetheless be a reduction in normal gut flora. And then what you want to do is give the gut a couple of weeks to recolonize with the appropriate organisms, right? So that's the idea behind it. It's interesting, as I said, I practice in a low-income community, and I'm privileged to see particularly a lot of older adults who are just beautifully and brilliantly cared for, sometimes under very difficult circumstances by family members who are very dedicated to the older adults in the community. And let's say that I would see a older adult, typically a woman, an older adult who I just diagnosed with community-acquired pneumonia. I'm going to send her home on an antibiotic. She's suitable for outpatient treatment. She's going to get the song and dance about if this deteriorates, that deteriorates, needs to go right to the hospital. I'll arrange for a 24-hour follow-up on telehealth, and then probably 3 days later, if doing okay, back in the office to ensure that she's recovering. So I will often think to myself, her insurance would pay for her ICU stay with fulminant C. diff, wouldn't it? Yep, it would. But will her insurance pick up the tab for $20 worth of a probiotic? No, it won't. And the better quality probiotics are not inexpensive. They're really not. But, it'll be about $20 for a full course of therapy. So what I will very often do is say, okay, the antibiotic, I'm sending the prescription into the pharmacy. I want to make sure that you pick up the prescription, or somebody will help you pick up the prescription just like as soon as possible, because you want to get your first dose in right away. But I also want you to start on a probiotic that will help minimize the risk of you developing diarrhea and a number of other complications from being on the antibiotic. And invariably the question comes up, will my insurance pay for the probiotic? And I have to say, no, typically it doesn't. So a lot of times I'll get the pushback from the older adults saying, well, I'm not going to pay for a med that's not covered by my insurance. And what I will say is, okay, I know this person, and this person in your family. They'll chip in and buy this for you. You want me to give them a call? And very often, the next thing I know is the older adult, who's usually in the office with a caregiver, family member, and the family member will go, don't worry about it. We will figure out how to pay for this. And I know it's not a lot of money, but it is some money. And what people have to do is value this for helping a person avoid a really terrible, terrible, terrible illness. So what about using yogurt as your probiotic? Well, a couple of things with yogurt is it is calcium based, no big surprise. And you'd want to separate it from the tetracyclines like doxycycline or the fluoroquinolones by 2 or more hours due to the potential chelation effect that will reduce the antibiotic efficacy. You should never have calcium, iron, or another metal in the stomach at the same time as a drug like doxycycline or a fluoroquinolone because of the chelation effect that will minimize the effectiveness of the antibiotic. Refrigerate bacterial probiotics to maximize viability. And for people who have a chronic GI issue, they should be advised if they're taking it for IBS or the like, that it's not going to be an overnight cure and that it will also not result in permanent GI colonization, that you need to keep up with therapy.